I see a lot of immune deficiency compromised patient in my practice. Once a month, they're able to control their symptoms very effectively, sometimes 80%. Slow infusion, we give them normal saline, we give them multivitamins, anti-nausea medicines. That's one of the options. We can also, there are two different arms of immune system. One is causing the allergies and one is causing So a lot of times when we see asthma patients, they have been to their primary care doctors, family doctors, urgent care. They have been admitted in the hospital because they're short of breath, or some, especially the young ones, they cannot participate in the sports. Usually parents bring them, or they say, oh, whenever I get sick, I can't breathe. So those are the most common complaints I see when the patient comes in. Basically, based on history, we figure out, seems like asthma, we have a specialized way of testing the bronchial airway response by doing a spirometry test or breathing test, we call it. We look at the test results, see how the lung response is to the medication or without the medicines. If that shows asthma, we start the patient on a treatment. There are several treatments available depending on what's the trigger for asthma. For some patients, the trigger is cold air. For some patients, the trigger is environmental allergies or dust mites or dog or cat allergies. For some patients, there is no allergy, but they still have asthma. Based on what is the trigger, we can prescribe those patients a combination of inhaled corticosteroids, a bronchodilator treatment. If they're allergic, we can prescribe them immunotherapy. And if none of this has worked, or the patients have tried it in the past, we have specialized biological treatment which are available, which we can offer in the patients after doing a careful examination of their blood and making sure the patient qualifies for it. So there's a lot of stuff available in our practice which we can offer to the patient, provided we are able to do all those tests and carefully tailor a specialized plan for these patients. We see asthma in young kids and we see asthma in adult kids, and both of them, when we see them, we have different type of plans and they're very curative.
And as far as asthma and seasonal allergies go, do you see a lot of seasonal allergy patients with asthma getting allergy injection therapy?
Yeah, so it depends on the time of the year. Around December, January, February, March, we see a lot of patients who gets triggered in their shortness of breath by the tree pollens, like oak pollen or the pollens which are around in this area. So yes, they have pollen allergies. They come in and we investigate them, find the right solution for them, and treat them appropriately. During the summertime, we see a lot of patients who have allergies to grasses or mold because we get very humid over here. Mold spores goes up. Also, there's a lot of grass because there's a lot of rain. So we see a lot of patients having triggered with the grass allergens and mold allergens. Just around fall time, we see a lot of patients having allergies because of weed pollen. So we treat it appropriately. Allergen immunotherapy is a very effective way of treating and sometimes even curing some of these asthma patients if we are able to catch them at the right time. And yes, allergy play a huge role in triggering of these asthma. And with our treatment plans and the right portion of therapy and right regimen, most of them are able to live a very healthy life without compromising their lung health.
And do you see a lot of patients with urticaria or a lot of rashes related to allergies?
Yeah, so I would say 50% of our medical practice, we see a lot of skin problems or skin allergies. So that's why we deal with a lot of atopic dermatitis, urticaria, psoriasis, pretty much any rash on the body, we see it at all. A large portion of our medical practice, we see urticaria or hives. We have a specialized protocol to investigate those patients. We perform some blood testing, we perform skin testing. We try to find out if there's any autoimmune trigger to these conditions, which sometimes it does. Come up with a specialized treatment plan for them, which we have perfected over the past 10 years or so. And almost 80 to 90% of the time, we are able to cure their urticaria problems within first 3 months. And if you're not able to control that with the use of medications, we always have an option of using some specialized biologics for those patients, which is very curative and comes out with least amount of side effects.
Do you see a lot of patients with immunodeficiencies in your practice?
Yeah, so as you know, we are allergy and immunology practice. I am board certified in allergy and immune system evaluation in both adult and pediatrics. I'm one of the very few allergist in the town who also is immunologist, and I see a lot of immune deficiency or immune compromised patient in my practice. Um, I see very young patients, sometimes as young as 4 or 5 years old, and I have some very old patients who have immune deficiency. Sometimes the immune deficiency is identified very early in the age, and sometimes it takes few years of recurrent infections to get diagnosed. Again, as with most of our conditions that we see, I have a very specialized protocol to investigate those patients. If patient is having recurrent infections, not feeling well, missing a lot of schools, having bloodstream infections, so we bring them in. We do the consultation, we check their immune system, we evaluate it for immune competency, and if we find there is a deficiency in immune system, we try to do a genetic workup to try to find out if our parents are the carriers for it. And if we are able to get all this information, we pick up the right medicine treatment either in office or in home to get their immune system fixed. Although, if you have immune deficiency and you're getting recurrent infections and we diagnosed it, there's a fix to it. We can always help those patients and live a normal and healthy life.
And what kind of medications are we able to provide patients in the office for with
Sure,
immunodeficiencies?
it depends. What are we dealing with? If we are dealing with recurrent infections, we can give them IV antibiotics, intramuscular antibiotics if that they need. If we need to administer immunoglobulins, which are the treatment for immune deficiency, we have several ways of administering them. We can administer them in the form of intravenous infusion in our clinic, which can sometimes last 4 to 6 hours in our clinic. It's a slow infusion. We give them normal salines, we give them multivitamins, anti-nausea medicines. So that's one of the options. We can also administer the similar medicines or same medicine sometime in the form of subcutaneous infusion using an infusion pump. Or if they're not able to use any of the infusions in our clinic, we can offer the similar service provided by third party companies in their convenience of their home, and they can self administer sometime, or sometimes the nurse can come in and help them get that infusion, and we can just monitor in the clinic how well they are, and if they have any problems or infections, we are just a one phone call away.
Can patients with immunodeficiencies also get allergy injection shots?
Yes, so we have some unique conditions over here. Some patients who have immune deficiency, their recurrent infections are being triggered by having allergies to the environmental allergens. Remember, there are two different arms of immune system. One is causing the allergies and one is causing the recurrent infection. If there's a weakness in one arm, doesn't mean that the whole immune system is weak. One arm of the immune system can be very strong and overreacting versus the other arm is weak. So some of these patients who we diagnose can end up getting immune deficiency workup, also has hyperactivity in their immune system and have allergies. So we can treat allergies with allergy shots and immune deficiency with the immunoglobulin infusion, and that works very well. And we have some patients who have that.
Have you seen any kind of like reactions with, immunodeficiency patients getting allergy injection shots since their immune system is very.
Not more than, none of these patients are especially at risk of having anaphylaxis. They do very well with allergy shots. With the immune deficiency patients, when they're on immunoglobulin replacement, sometimes they complain of minor headaches with these infusions. But most of the time, the way that we try to administer these medications, including immunoglobulins, they do very well. It's a very good tolerance. We educate our patients. We try to tailor the therapy based on their height, weight, and their tolerance level. So they're most of the time within first 2 to 3 months after starting the therapy, they're very happy.
And what are the most common side effects that a new patient getting this IVIG treatment? What are the most common side effects that you usually see in your
So
office?
most of the time when I see these patients with immune deficiency, the most common side effect is after getting the infusion, sometimes they complain of having headaches. And that's because the immunoglobulin infusion itself is very thick in consistency. When it is infused in the blood or even in subcutaneous form, it pulls the water and can cause the dehydration in the vessels. So what we advise our patient is to drink at least 2 liters of water before the infusion, 2 liters water on the day of infusion, and 2 liters the following day to keep them well hydrated. And if they cannot keep up with that, we can always offer them a intravenous saline or anti-nausea medicines or anti-headache medicines in our clinic if they're our patients. And we have done it several times in the past, and that works very well.
What kind of patients get biologics at your office?
So, biologic is basically a term for some of the specialized medicines which are in past 10 to 15 years become more very effective in treating some of these clinical conditions. Biologics are basically bioactive proteins which are effective in going inside the body and turning off a switch of a production of other type of proteins. We have different type of biologic available. We have Xolair, we have Dupixent, we have Fasenra, we have Taspires, and most of them are very effective in considering or treating specific conditions in a very different way with least side effects. Remember, over here, what we are trying to do is we are trying to bring the quality of the life of the patient up and trying to reduce the hospitalization. Like Xolair is very effective in taking care of patients with urticaria. If these patients have urticaria, with the Xolair injection once a month, they're able to control their symptoms very effectively, sometimes 80%. Same Xolair can be given to severe asthma patient and is usually given every 2 weeks. Again, same rule, it's anti-IgE, it's very effective in controlling the symptoms. We have another excellent biologic, it's called Dupixent. We use it a lot in our practice as well. It treats atopic dermatitis. It can treats eosinophilic esophagitis. It controls the symptoms of nasal polyps, and sometimes it's the sole therapy which is effective in atopic dermatitis as well. So all these biologics are very effective in controlling these symptoms. Taspar is very good for the control of moderate to severe asthma, and they call least side effects. But we do a workup before to make sure the patient qualifies for it before we go to the biologic. We exhaust all these resources of using inhalers, oral medications, immunotherapy before we trigger, before we start using the biologic.
And is it easy for patients to get these biologics? I know you said that they have to try other medications.
I mean,
but-
there is a process to get to a biologic. We do not just offer biologic from a get-go. There is a process. We have to try different medicines for some time. It does require a specialized approval from some of the insurance program. It's not very readily available therapy most of the time, so we have to try other therapies before we can. But once we get started on it and it is shown to be effective, then it's a very easy process. All our patients come to our clinic. We schedule the delivery of biologic in one of our clinic site, and our qualified nurse safely administer those biologics in our clinic using a specified way how to use them. And patients do very well, and most of the patients are very happy once they get on.
And so patients can't get the biologic at home, correct?
Well, some patients, if they're traveling, they can consider that, but 99% of the time, we encourage patients to come to our clinic and have a biologic given by our qualified medical assistant or our healthcare provider before they can go home and monitor their symptoms by themselves.